Behind every single successful surgery, there's an anesthesiologist. They're the silent guardian in the room, making sure everything goes smoothly. But right now, there's this invisible crisis happening behind the surgical mask. It's a burnout epidemic, and it's pushing this absolutely critical specialty right to the brink. Today, we're going to dig into the scale of this problem, what's causing it, and what on earth it's going to take to heal the system.
Okay, let's just start with a number that should really stop you in your tracks. 67.7%. That is the percentage of attending anesthesiologists in the US who said they were experiencing burnout after the pandemic. I mean, think about that. That's more than 2 out of every 3. This isn't just a few doctors having a bad week. This is a full-blown systemic crisis. So, to really get what's going on, we have to be clear about what burnout actually is. It's not just about feeling tired. The World Health Organization defines it as a specific occupational thing. It has 3 main parts. First, just total exhaustion and energy depletion. Second, you start to feel this mental distance from your job, a kind of cynicism. And third, you get this feeling that you're just not good at your job anymore. It's like the slow chipping away of everything that makes you effective. First up, let's get a real diagnosis of this crisis. The data is pretty clear. COVID-19 made everything worse, for sure. But it was really just throwing gasoline on a fire that was already burning for a long, long time. And you can see that trend so clearly right here. Even before the pandemic, burnout was already at a shocking 59.2%. Then, the massive pressures of COVID came along and shoved that number all the way up to 67.7%. So yeah, the pandemic didn't create the problem, but it absolutely pushed an already stressed out system way past its breaking point. So what are the specific pressures that are causing this whole epidemic? I mean, if we want to find a cure, we have to understand the disease first, right? So let's dissect the anatomy of this burnout, looking at everything from the individual level all the way up to the entire system.
And let's be really clear about something. This is not about doctors lacking resilience. Doctors will tell you it's a completely rational response to a work environment that's deeply broken. The big drivers they point to are systemic. Things like severe staffing shortages that force everyone to do more with less, feeling like they have zero support from the people in charge, the grueling hours, losing control over their own work, and, the isolation that comes with a specialty where you're just focused so intently on one patient at a time.
And these aren't just vague feelings. They translate into very real, very measurable risks, especially for the folks in training. The data shows that working more than 70 hours a week, well, that more than triples your odds of burnout. Taking more than 7 overnight calls in a single month, that increases the odds by 2.5 times. These are concrete conditions that are directly fueling the crisis.
And beyond just the insane hours, this quote, wow, it really gets to the heart of it. 2 physicians, Phillips and Ballard, they point to this deeper, more emotional driver. It's the feeling that the professional autonomy they trained so hard for is just slipping away. And that this thing that once felt like a true calling is being turned into, well, just a job, thanks to all the bureaucracy and financial pressures.
But okay, here is where the story takes a really fascinating twist. While burnout was absolutely skyrocketing in the US, a big national survey of anesthesiologists in China showed the exact opposite trend. Their burnout rates actually went down during the same time period. They went from a high of 69% before the pandemic to 52.7% after. So what in the world is going on here?
Well, the difference seems to be a massive systemic intervention. See, back in 2018, China's National Health Commission saw they had a severe staffing shortage, and they launched a national plan to fix it. And get this, by 2023, they had increased their anesthesiologist workforce by 38%. Now, they still have shortages, but this strongly suggests that taking big, intentional action to fix a core problem, like staffing, can have a huge positive impact on burnout.
And look, this isn't just a personal tragedy for physicians. A burned-out doctor creates this dangerous ripple effect that threatens patient safety and the financial health of the entire healthcare system. This is not just a doctor problem, this is an everybody problem.
Let's be perfectly 100% clear on this point. The connection is direct. It's undeniable. A physician's well-being is completely tied to the quality of care their patients get. When the caregiver isn't well, the care itself is at risk, period. Think about this for a second. In one study, a full 10% of anesthesiology residents who were suffering from high burnout and depression, they admitted that they often fall short in the quality of care provided to patients. 1 in every 10. That's terrifying.
Now compare that to the residents who had low burnout scores. That number just plummets. We're talking 0.36%. The gap between those two numbers is just staggering, and it represents this massive threat to patient safety that is created almost entirely by the strain we're putting on physicians.
And the financial cost? Oh, it is just as staggering. Physician burnout is estimated to cost the U.S. healthcare system over $4 billion every single year. And you know what the biggest driver of that cost is? Staff turnover. Experienced doctors are either cutting back their hours or they're leaving the profession entirely, and that is incredibly expensive. I mean, just think about the business case here. The cost to recruit, hire, and get a new physician up to speed is estimated to be 2 to 3 times their annual salary. So from a purely financial perspective, failing to invest in the well-being and retention of your current doctors is just a catastrophic business decision. So if the diagnosis is this clear, what's the treatment plan? Well, all the evidence suggests we need to stop just treating the symptoms with Band-Aids and start actually redesigning the system to address the root cause of the disease.
This really brings us to two totally different ideas for a cure. On one side, you have what a lot of people call superficial fixes. Yoga classes, meditation apps, resilience training, which basically put the burden of fixing a broken system on the individual. But on the other side, you have the real systemic solutions that experts are begging for. Adequate staffing, real institutional support, giving doctors their professional autonomy back, and actively building a sense of community.
One really key concept that's coming up more and more as a powerful antidote to burnout is this idea of belonging. It's defined as that feeling of being personally involved in a system where you feel valued, you feel needed, and you feel like you're on the same team, working towards the same goals. This directly fights back against that isolation and lack of support that are such huge drivers of burnout.
So this gives us a pretty clear path forward, right? It's almost like a 3-step treatment plan for healthcare organizations. Step 1, enhance genuine workplace support so doctors actually feel seen and valued by leadership. Step 2, actively create that culture of belonging to break down the isolation. And Step 3, find ways to restore physician autonomy, to reconnect them to the meaningful work that made them want to become doctors in the first place.
In the end, the solution might just boil down to this one simple but really profound idea, something called the progress principle. It says the single most important thing for boosting morale is just letting people make progress in work they find meaningful. So maybe the cure for burnout isn't another wellness app. Maybe it's just removing the barriers that prevent doctors from doing the job they were trained and called to do.
Which leaves us with this one critical question. We have a healthcare system that is systematically burning out its most essential caregivers. The challenge then, for all of us, hospital leaders, policymakers, patients, is to figure out how we build a new system. One that doesn't just heal patients, but one that knows how to heal itself.